This segment of Delmarva Life is brought to you by Delmarva Dental Services.
You have probably heard the phrase, pay me now or pay me later. Usually that means you're better off taking care of something now instead of waiting and possibly having bigger problems.
And that saying certainly holds truth when it comes to your teeth. You know, nobody likes to have dental procedures like a root canal or getting a crown on a tooth. Some even opt to have the tooth pulled instead. Well, you may be surprised how much you will pay if you avoid restorative procedures, and we are not talking money. Your teeth, they are so important. In fact, they do more than you may realize.
A lot of things besides just chewing and looking nice. They help you with your speech. They're going to help you digest your food better. They're going to support the muscles and the skin on your face. So aesthetically, functionally, and even just talking and socially. There's a component of how you feel about how you look or appear to others, and that goes along with your teeth. Yeah.
Leaki says some patients choose tooth extraction over saving a restorable tooth for a variety of reasons. It may be perceived as easier and less expensive.
While really in reality doing a crown is a very standard procedure for the dentist and really requires almost the same amount of chair time for the patient as doing a filling. For a patient that's never had a crown before, it seems overwhelming.
But in the long run, Dr. Aki says it may not be. That's because your teeth work together to achieve all of those functions. One missing tooth can really put a wrench in the works.
Once you lose a tooth, though, you can have a variety of different things that happen in your mouth to the other teeth and the surrounding tissue and everything, kind of cascading effect.
And those effects can send you right back to the dentist chair.
Say you would need more than just a filling on a lower molar, or it's broken and it can't be restored by your dentist at this point, or you need a root canal and you just can't afford to do the root canal, you choose to take the tooth out. Initially, you're going to lose a little bit of bone when you have that extraction done. But what can happen is the tooth behind it can start to tip in. The tooth above it can actually start to drift down. And so then you've got maybe 2, 3, 4 other teeth that have now changed in position, which affects your bite, which may affect the health of those teeth if they lose bone around them. So you can cause these other kind of issues to start happening. And it may be slow at first. But over time, it can really become a problem functionally.
You can see that progression in this picture. The upper molar has drifted down because the opposing lower tooth is no longer there. And Dr. Aki says it would take work to both the upper and lower areas in order to put in a bridge or single tooth implant. Some of that work may involve restoring cracks in remaining teeth that are caused by the tooth that has drifted from its original place, or even worse, extracting remaining teeth.
So sometimes those teeth can be lost if they've tipped too much, they have enough bone loss around them, they lose support, or they can even crack and break if they start to hit the other teeth in a different way because they've been able to shift and move around.
But the work is much more extensive if extracting a restorable tooth happens over and over again.
When it's a whole mouth, if you've taken one out here and then, well, you know, I chose to extract that one, I think I'm going to do that same thing again if another tooth happens to have a problem. When you're missing multiple teeth, it can become a much more comprehensive treatment plan and require a lot more work to fix everything when your bite kind of looks like a roller coaster. It's not always even anymore.
The unevenness can affect the shape of your face.
When you start to lose more teeth, especially the back teeth, you'll find that the cheeks sink in. If you're losing a lot of back teeth, you lose what we call vertical dimension. So the bite doesn't have anywhere to stop. And then you look over close. So your chin and your nose, the distance between the chin and the nose gets closer together, and that's when it looks like the chin sticks out. It can make people look unhappy and definitely makes them look older.
Furthermore, Dr. Aki says missing back teeth spell trouble for front teeth.
You get that overclosed effect, but you also put a lot of force on the front teeth, which aren't intended to do heavy chewing and functioning. So then you're creating another problem, which is heavy forces on those creates breakage or heavy wear, and you're kind of, again, that ripple effect of decisions that may have been made years ago are now affecting what you have left.
The bottom line, prevent tooth problems that you have control over. That means brushing, flossing, limiting sugar intake, and making routine visits to the dentist. If you do have a problem with a tooth, get it fixed. Because, like a chain is only as strong as its weakest link, your smile is dependent on all your teeth working together. And here's an interesting fact. Teeth actually stimulate your jawbone to maintain its density and form. When the teeth are gone, the bone loses that stimulation. And if you want to learn more about the consequences of missing teeth or to learn more about Delmarva Dental Services, go to our website, delmarvalife.com.
I need to get back to the dentist. It's been too long. I need to go. I need to get there.